Have you ever paused to ponder on the rhythmic thumping sound within your chest? This rhythmic symphony is not just a beat. It is the very rhythm of life itself, your heartbeat, a marvel of the complex mechanisms within your heart. Today, we shift our focus towards an essential aspect in the medical world: heart sounds and murmurs. Sounds and murmurs is not simply a matter of curiosity. It's a crucial element in medical diagnosis and patient care. It provides physicians with a unique window to observe your heart's performance, to detect abnormalities, and to monitor any changes in your heart's health. By exploring auscultation findings, diving into location specifics, investigating characteristics, understanding dynamic maneuvers, we can identify if the rhythm of your life is hitting all the right notes. We aim to delve deeper into the physiology and ultimately uncover these sounds' pathologic features. Not only does this knowledge arm doctors with more precise diagnostic tools, it also aids in guiding treatment plans and even predicting prognosis. An exciting and insightful journey lies ahead as we delve into the captivating and critically important realm of heart sounds and their underlying. Heart sounds are not just simple lub-dub beats you hear, they are the audible testament of your heart's dedicated pumping action. Each lub-dub signifies the rhythm of your heart valves process as they meticulously regulate blood flow. The first heart sound, lub, represents the closure of the mitral and tricuspid valves at systole, a phase when your heart muscle contracts to push blood out to the rest of the body. This is known in medical terminology as S1. The second sound, the dub, follows the lub, and is the result of the aortic and pulmonary valves closing at diastole. This is when your heart is at rest and fills with blood, a phase technically referred to as S2. But heart sounds aren't limited to these two. There are also extra or abnormal heart sounds known as S3 and S4. S3 is often heard in patients with heart failure and is described as a gallop rhythm. S4, on the other hand, is associated with a stiff or thickened left ventricle, commonly seen in conditions like hypertension or heart damage due to a heart attack. These additional sounds provide crucial clues about cardiac health, making them key elements of cardiac diagnostics. Occasionally, extra sounds interrupt the steady lub-dub rhythm we associate with a healthy heartbeat, creating what are termed as heart murmurs. These are not always viewed with unease, as they can range from being completely harmless to severe heart conditions. Heart murmurs come in various types, with their own set of potential causes. For instance, systolic murmurs occur during the heart's systole, or the contraction phase. This could be due to conditions like heart valve stenosis, where the heart valves narrow, or hypertrophic cardiomyopathy, where muscle thickens abnormally. Diastolic murmurs, on the other hand, take place during diastole, the relaxation phase of the heart. They could indicate issues like aortic or pulmonary regurgitation, where the valves do not close properly, allowing backward flow of blood. Heart murmurs can also be characterized as innocent or pathological. Innocent heart murmurs are typically harmless and can occur due to factors like physical exertion, pregnancy, or fever. Pathological murmurs, however, are indicative of underlying heart problems such as valve abnormalities or defects. The distinction between these murmurs is defined by their characteristics like timing, intensity, and location. Timing pertains to the murmur's occurrence during the cardiac cycle. Intensity measures the loudness, and quality describes the nature of the sound. Location indicates where the murmur is most audible. In essence, each murmur has its own unique fingerprint, characterized by its timing, intensity, quality. In addition to changing body positions or performing exercises, other dynamic maneuvers can similarly affect the intensity of heart murmurs and assist physicians in diagnosis. For instance, squatting is a posture that can increase the blood volume returning to the heart, and as a result, certain murmurs become louder and clearer. Similarly, the use of hand grip exercises can increase the resistance to blood flow, magnifying murmurs caused by mitral regurgitation. Apart from physical maneuvers, pharmaceutical interventions like amyl nitrite inhalation might also be used. This lowers peripheral vascular resistance, which can help in identifying aortic stenosis. Another common physiological maneuver is the rapid passive leg raise, which quickly increases the blood volume returning to the heart, making murmur caused by conditions like aortic stenosis more obvious. Using all these maneuvers, physicians can alter the intensity and quality of heart murmurs, improving their ability to diagnose the underlying condition. Physiologically, heart sounds and murmurs serve as a critical tool for assessing the condition of the heart. These acoustic signals can provide a wealth of information about the heart's well-being. For instance, they can provide insight into conditions as diverse as valve stenosis and valve regurgitation. Valve stenosis, a condition characterized by the narrowing of heart valves, impedes the smooth flow of blood, which can be detected through specific changes in heart sounds. Conversely, valve regurgitation is a condition where the heart valves do not close completely, resulting in the backflow of blood. This too can be identified by unique auditory signals. Therefore, the sounds of our heart are like a language that speaks volumes about our cardiovascular health. Pathologically, the heart sounds and murmurs can act as a beacon, illuminating a wide array of heart conditions. These sounds can be a window into the heart's functioning, indicating issues like valve stenosis, where the heart valves become constricted, restricting blood flow. Similarly, in the case of valve regurgitation, where the valves fail to seal completely, allowing blood to seep backwards, specific murmurs can be heard. Thus, in pathology, heart sounds offer an auditory roadmap that can guide us towards understanding and diagnosing numerous heart conditions. Decoding heart sounds and murmurs is akin to mastering a complex new language. These audio signals are essential indicators of the heart's performance. The characteristic lub-dub sound we associate with the heartbeat is the audible evidence of heart valves opening and closing, essentially denoting the cyclic pumping action of the heart. Heart murmurs, on the other hand, are additional sounds that can hint towards an escalated blood flow rate or grave situations such as valve malfunctions or congenital heart defects. The process of understanding these sounds involves a thorough examination of their timing, intensity, quality, and origin. Any changes in these patterns during dynamic maneuvers. These auditory markers provide us with invaluable knowledge about heart health and functionality. By scrutinizing these sounds, we can detect early signs of heart disease, monitor the progression of an existing condition, or even evaluate the effectiveness of a treatment strategy, making it an indispensable tool in our medical toolbox. This unique auditory examination can help healthcare professionals make informed decisions about patient care and treatment plans, improving overall outcomes. So, understanding heart sounds and murmurs is not just about translating the language of the heart, but using this knowledge to enhance our potential. Remember, every heartbeat tells a story. Each beat, each rhythm is a narrative of life. A tale of survival and resilience. This wonderful symphony, a harmonious blend of sounds, echoes, and murmurs, all synchronized to compose a melody that is as unique as the individual it belongs to. In future episodes, we will be amplifying the importance of understanding heart sounds and murmurs. It is not just a medical necessity, but an invaluable skill that can help us comprehend more about the human body, ailments, and overall health. Through in-depth knowledge and auditory skills, we can learn to decipher this profound narrative. We can comprehend the rhythm of life, melody of existence, resonating from the core of our being. The language of our heart is complex, yet intimate. It requires patience, skill, and knowledge to interpret. An exploration into this captivating symphony beyond the basics can aid in early detection of heart diseases, understanding patient symptoms better, and contribute to effective prognosis. So stay tuned as we delve deeper into the heart's melody and unravel its mysteries in our upcoming episodes.